Luke here with another episode of Shoulder Guy Physiotherapy News. Now this week we're bringing you tips from the clinic, things that we've noticed that have really worked in our clinic this week. We want to bring those to you today in today's episode. So the first big tip, massage and trigger point release works. In my experience, massaging around the scapula and also the periscapular muscles, the rotator cuff muscles, really works. And in particular, the trigger point release. Okay, there's trigger points that actually have developed within the infraspinatus and supraspinatus muscles. They're very, very predictable, and I've found that we can find those trigger points very easily, and then with continued release over numerous treatments, we can help to free up the muscle tissue, free up the fascia, allow better mobility of the shoulder blade, and it particularly helps really well with pain relief as well. So obviously you're not going to start out with deep tissue massage or trigger point release potentially on your first visit, but slowly working into the deeper tissues and the trigger point release can have a great effect on pain, on mobility, and then on muscle activation. Some people actually use dry needling instead of the thumb work. I do a lot of thumb work myself, so I'll have to think about doing some dry needling down the track, which can really be a great adjunct to the trigger point release therapy. So massage and trigger point release therapy works. So you want to include that in your program somewhere. Either whether you're a physiotherapist, you want to start to think about that, or whether you're doing things at home. You can do a self trigger point release using a golf ball or a tennis ball into those key areas within around the scapula and also within the rotator cuff tissue as well. So the next tip, doing less can actually produce big results. Now I've found that in older patients, doing less actually produces better results. Okay, these people aren't meant to be Olympic athletes. They will not have perfect range of motion. They may in fact have some pathology, underlying pathology, okay, that we do not potentially want to stir up. They may be starting out in a very deconditioned state. So we don't want to push them. We don't want to drive them too hard. We don't want to expect too much of them. Now what I've found that doing less and making small changes actually produces bigger results for these type of clients. Okay, so that might mean we're going to start out with very light loads. We might do things on alternate days. We might not give them a whole fully blown program. Okay, we're going to do things gently. We're going to stretch gently. We're going to mobilize gently, and we're going to activate the key muscles very gently. We're certainly going to do it consistently, but we want to take things nice and easy with the older client. Okay, the next tip, you want to do a shoulder health check. There's some shoulder conditions that just creep up. They're insidious. They're upon you before you actually realize. So let's say, let's take frozen shoulder for example, okay, or a mild case of adhesive capsulitis. Now some of the first signs that you've got a problem with your shoulder will be a restriction in shoulder motion. So one of the best shoulder health checks you can do is actually to look at your range of motion. You might check how far you can externally rotate to take the hands away from the tummy. You might check that you can put your hand up into a high five position or bring your arm across to watch the opposite shoulder, and also then putting the arm up behind the back. You might have trouble doing your bra. So you want to compare it to your good side if you've got one, but also every now and then, if you're using your shoulder a lot, you want to just do a health check. Make sure that you've got good shoulder strength. But in this case, make sure you've got good shoulder mobility. Because a lack of mobility can increase the forces across the shoulder joint and it can make muscles work harder. Okay, so range of motion is so important. So I would encourage you to do a shoulder health check regularly, especially if you're using your shoulder on a regular basis, and especially when you're requiring a high performance output from your shoulder. Now I've had a patient in the clinic this week who had a major fracture to the upper part of their arm, their proximal humerus, and what we really did for her was just to encourage her to move. We gave her permission to move. She was shutting the shoulder down, she had it in a sling. The x-ray was looking good. There was signs of some good bony healing, some good callus formation, and we wanted her to start to move that shoulder, because what we know about four-part proximal humerus fractures, they can become quite nasty. They can become very stiff and they can become problematic. So we gave her permission to move, and in doing so she started to use the arm at home, she started to perform the range of motion exercises more aggressively, and now 4.5 to 5 months down the track she is doing extremely well. She's very close to full range, she's got good function, and she's developing her shoulder strength, and overall she's a very, very happy patient. So encourage your clients to move when it's appropriate. Give them permission to go ahead and move. Okay, they're the tips from this week. I really hope that they help you. My name's Luke and I'm the Shoulder Guy, and I'll see you again with another episode of Shoulder Guy Physiotherapy News. Bye for now.